I guess, firstly, I just want to say thank you and welcome to everybody to this call. We've already been through the Commonwealth Games, we've been through Neighbours, but I think the importance of these sessions is paramount to sort of retaining some of the great staff that we've built up through the vaccination programme, and really opening eyes and hopefully avenues for those who have never considered some of the things that you're about to talk about. So I guess with that kind of in the forefront of your mind, it's over to you, Will, and you can start presenting, and we'll switch our videos off and we'll sort of enjoy the show.
Slides should just be loading. Okay, so I can see the slides on my screen, so I'm assuming everyone else can see it on theirs as well. I think I saw a thumbs up, so that's great. My name's Will, and I'm the AHP faculty lead for Frimley ICS, and I'm a physio by background and still working as a physio at Frimley Park Hospital, specialising in hip and knee injuries. So thank you very much for joining the call and listening to me today, because I've got a few things I want to present about allied health professionals and maybe the career pathways within those professions. I probably will slip into using a couple of abbreviations, those being ICS, which is Integrated Care System, and AHPs, which is Allied Health Professionals. So apologies for that. It's just out of habit, but anyone has any questions or pop their hand up if something I'm saying doesn't make sense, then please just let me know. So Frimley ICS is shown there on the map. On the left, you can see the southeast region, and Frimley ICS is kind of squeezed in the middle there between Bob, Surrey Heartlands, and Isle of Wight and Hampshire ICSs. And then on the right, you can see kind of the geography of where we span. So I'm going to talk a little bit today about some of the opportunities across the Frimley ICS. So the top of the ICS is kind of Slough area in Maidenhead, and then we go down through Bracknell, Camberley, down to Farnborough, Fleet, and all the way down to Farnham. So it's quite a wide area, and there's lots of different opportunities for allied health professionals across this region. Or not region, ICS. So the allied health professions that work within Frimley ICS are listed here. There's 15 allied health professionals in total. I don't think I've got time to talk about all of them in detail today about what they do and their role, but I have got a few links later on so you can get some more information about maybe some of the ones you might be interested in learning more about. The ones in red who are currently working within Frimley ICS. So we've done some scoping to see where the allied health professionals are within the system, and those are the ones that we know are working within Frimley ICS. We haven't been able to locate any drama therapists yet. I feel like there may be a few out there, and therapeutic radiographers, although they may live in the area, there is no commissioned service for therapeutic radiography in Frimley ICS. The nearest would be Guildford, so the Royal Surrey, for any treatments that requires therapeutic radiography. And AHPs make up the third largest workforce. So all those professions combined are the third largest workforce within the NHS, behind nurses and midwives and doctors. They're about, I think, I've got it written down as I think, I can't remember this, but there's 117,000 people who have AHP careers in the UK. So it's quite a high number, but we still need more and are still looking for more to better support our communities. And like some of the names there, you may recognise things like paramedics and physiotherapists, but there may be others that you're not so aware of, things like orthoptists, maybe osteopaths you might have heard of, or operating department practitioners. So like I said, I'm going to put some more information later onto the slides to get a bit more information on some of these professions, like operating department practitioners. There's quite a big profession, but maybe people haven't heard of them before. And what do allied health professionals do? So we work across from paediatrics to the care of the elderly, so spanning the whole lifetime, and varied kind of areas that we work in, looking at kind of prevention, maximising the potential, improving health and well-being, and helping people to live full and active lives. That might involve diagnosing and treating problems, reducing pain, helping people to manage long-term health conditions, and ultimately trying to help people enjoy their lives to the fullest, and enjoy the activities that help them to do the activities that make them happy. I didn't write this, this isn't my quote, but I've heard it before, and I think it does kind of roughly summarise a little bit about what AHPs do. So doctors save lives, AHPs make them worth living. So we're looking at how can we support people and their quality of life to kind of maximise their potential, really. So I've talked a little bit about the different allied health professions there. We've also got AHP support workforce. So these support workers help and support allied health professions, and there's a few there listed of support workers that we have within the ICS. There's a couple there that we don't have within the ICS, and that's orthotics and art therapists. They may be support workers in other areas, but I haven't been able to locate any. If anyone knows of any, I'd be really keen to know who they are and where they are, so I can reach out to them. And the support workforce work within the NHS of bands kind of 2 to up to 5, and they're known as the unregistered workforce. So they've got qualifications, but they're not registered as a health professional, like having a qualification of physiotherapy or occupational therapy to make them part of the registered HCPC workforce. But they've got loads of skills and experience that really help support the patients and support those professions to do their work to their fullest. I mentioned bandings, bands 2 to 5, but there'll be support workers within other settings within the ICS, so like working for local authorities like Slough Borough Council or Bracknell Forest Council, or Royal Borough of Windsor and Maidenhead. There's Optalis there that they maybe have band 3s or 4s working within their teams, or equivalent pay, but they wouldn't be technically called bands on a banding. So if you are looking for jobs in those areas, it might not be quite the same as what you'd see on NHS jobs in terms of the banding, but it does equate to kind of similar levels of pay and kind of competencies of what they'd be carrying out within their work. So as I mentioned, the AHP support workers make a significant contribution to service users and service delivery, and really help the teams deliver their priorities in line with the guidelines and protocols. And there's a few just examples there of how some support workers have felt that they've supported that. Our ambition for HPs from the ICS is, and this includes the support workers, is to create a roadmap to support the HP workforce from training to bridging the gap between their training and education, and then into employment, and enable all AHPs to achieve potential in their roles, and to work at where possible, the top of their scope of practice, and have the confidence to move into new roles and opportunities. And I've tried to kind of put that into kind of some kind of flow chart there, what that may look like, and essentially looking across the 4 pillars of practice at the same time. So we're trying to create opportunities for varied careers as well. So looking at kind of not just the clinical aspects, but the education, the leadership responsibilities, and research within all of our practice across allied health professionals within Frimley ICS. This is linked to our kind of workforce plan and strategy. I've listed on this slide just lots of different organisations where AHPs work within our system, which include health and social care providers, the private sector, ambulance trusts and charities. There's others that I haven't been able to squeeze onto that slide, but just to show where there's different options for work across the system, and that would be in the support workforce and in the registered workforce as well. And our aim within my role is to kind of work together with all these organisations to help it engage kind of with the workforce, to help support them and find kind of collaborative solutions to the shared challenges in terms of the workforce that we're facing. What I'd say with this is, if you're looking for kind of different opportunities within the ICS, it might not be that clear where the jobs are. So if you wanted a NHS job, for example, in Frimley Health NHS Foundation Trust or Berkshire Healthcare Foundation Trust and some of the others there like HCRG or CSH, then they'll be on NHS jobs, and you can look through Track on and see those jobs advertised and put an application through that route. But some of the other providers on there, such as Phyllis Tuckwell Hospice Care and Bracknell Forest Council, Slough Borough Council, Optalis, they may not be on NHS jobs, and I don't think they are. So it's worth bearing that in mind if you're looking for opportunities, and something maybe a bit different is to not just look down NHS jobs and look at other websites where those jobs may be advertised. Sometimes they pull onto other websites like Indeed, but you can't guarantee that with Indeed there's so many different jobs to look through there that you'll find the one that you're looking for. So I think it's worth looking at some of these other providers' websites to see their kind of vacancy page, recruitment pages. If anyone's got some interest in allied health professions, any of the ones that I mentioned earlier in those bubbles, then I'd really encourage you to check out Aspiring Allies, which is a website that's recently been put together. And if you just type in Aspiring Allies, it's the first hit on Google, and it gives a bit of information about the 15 allied health professions, so a bit more detail, and also links to videos like the WOW video, which I think should have gone out in your information packs regarding link to this webinar, but providing a bit more of an overview and detail of the different professions. There's another link there on the right, which is got some QR codes built into it. You can also Google this, but and you'll still be able to get to the right place. And it's a online work experience that we've produced with SpringPod. So SpringPod are the kind of the company that have put it all together, and it's a work experience for all the 15 allied health professions, so giving a lot more detail and information about those different professions. It's quite intensive, so there's lots of different materials on there and different stages that you can complete, but I'd really encourage you to check that out if that's something that you're interested in getting a bit more information about, and it will provide further information about kind of career paths of the next kind of your next steps, really, if you're looking to go down the registered route. So hopefully these slides may be shared with everyone on the call after today. If not, there's a list of some different links there that could be really helpful to look at to get some further information, and also links to kind of other job websites as well. I haven't included some of the local authority ones on there because I haven't had the chance to do that yet. But like I mentioned, they'd be worth looking directly at those local authority websites as well. So to become a allied health professional and to go down the registered route, so not the support worker, there's some different options. So you could work as a support worker and go down the degree apprenticeship route and be supported within the provider to do an apprenticeship path. And I'll leave that next bit to Caroline to chat a little bit more about. The other route, which is one that most people are aware of, is the undergraduate degree, and that's probably one of the more popular routes because the apprenticeships is a bit of a newer path, and larger numbers will go down the undergraduate degree. So after college or later on, going to university and doing a 3 or 4 year degree. Obviously, that can be quite timely and costly, and that's where the apprenticeship route can be potentially more appealing. The other route is the postgraduate degree, so doing a master's. If you've already got a qualification, for example, you might have a qualification in health science or health rehab, BSc, then there's shorter courses that you could do for certain professions, so that's worth checking out as well. I've just put on there my contact information, so my email's there and who I am. So if you've got any questions and want some more information, then please reach out. There's, like I said earlier, there's 15 different professions. So to go through them all today and all the different jobs that may or may not be available or paths you want to go down, and you've got anything specific that you're not sort of getting any joy with from looking online and that kind of thing, then I'm really keen to help. We've also got a Twitter page, which is at Frimley ICS AHPs, and very keen to get as many followers as we can, so please follow us. And there occasionally there's links to different opportunities that we try and post on there as well. So I'm going to stop sharing my screen now and pass you over to Caroline, who's going to talk a little bit about the apprenticeship route for AHPs. And I'll maybe answer some questions later, if that's all right, unless anyone's got any burning questions now.
Hi, Will. Thanks for that. What we'll do is we'll take the questions after Caroline completes her piece as well.
Okay, that's
great.
Thank you. Okay, so hopefully I'll be able to share now. Okay, is that? Oh yeah, so people can see that. Okay, so yeah, so Will's just asked me to come and explain a little bit more. I've sort of for a couple of months now been in the post. I'm sort of the AHP programme workforce lead for Frimley FHFT, but for apprenticeships I'm working with the faculty sort of on that apprenticeship sort of project group and leading on that. So again, I've just done sort of some examples of AHP support workers and sort of a place where you can find out more information on that. And just generally about apprenticeships. So yes, as Will was saying, it's one of the ways to sort of to progress your career sort of as a support worker, but also on to becoming sort of a registered AHP. So it's a good way of learning skills on the job. So you're getting paid at the same time as gaining a qualification. Places do for some of their for their current staff, and also you can have new. There are some adverts out there for apprenticeships coming within it. The whole idea is that you get about 20% classroom learning, and also then you go on to placements, and the rest of the time you're within your role as well and things. Not all AHP services have apprenticeships, so basically there is the list. So there are paramedics, speech and language therapists, prosthetics, orthotists, podiatrists, physios, ODPs, so the operating department practitioners, OTs, occupational therapists, dietitians, and the radiographers. I'm not sure that the art therapy one is currently running, but there is plans for that. So we're looking at generally, again, this is going with health, and there's sort of a slightly different for social care sort of banding and things. So there's the equivalents and things, but you've got your support worker, which is an entry level sort of a band 2 post, where you've got your general skills and you're working under close supervision. And you'd be sort of wanting people to be working at and gaining potentially the level 2 health and science apprenticeship. And that is a 12 to 18 sort of months time frame for that one. Then the next level up is the senior support worker, which is your band 3 sort of posts and things where they're working at more advanced skill, but still under some supervision. But there might be some core bits that they would work alone within strict criteria of what they're doing. There's more clinical, technical or scientific activities that they would be doing depending on which of the AHP services it is. And again, for that one, you'll be looking at your level 3 health and science senior healthcare support worker apprenticeship, which is between 18 to 24 months. And then you've got assistant practitioners in some levels as well, which is your band 4 people, where they're in more in-depth education and understanding of their health and illness, and they've got more enhanced skills, their speciality. And again, they would be the level 5 assistant practitioner apprenticeship level. Again, it's an 18 to 24 month sort of thing. And then what you've got after that is you've actually got your the level 6 ones as well, which takes you on to becoming registered AHP. So this slide is just looking at sort of the general healthcare career routes from the sort of the start and things where you're sort of your pre-employment and opportunities that you've got for gaining experience to be able to get onto a degree or onto an apprenticeship and things. So you've got your volunteering. There's all sorts of things that are on the government websites to help with things. There's functional skills if people don't have their maths and English that they need to be able to do things, then that they can sort of take those sorts of things. And then there's the support worker. When you're at a support worker level, there's T levels that can help, care certificates, and the apprenticeship level 2 with functional skills. We talked about the support worker, band 3 one with the apprenticeship and the band 4-5 posts. And then, yes, so the registered AHPs, band 5s going upwards, you've got the education, either you go direct to university, you know, to do the other option, and then, or you've got your apprenticeship level 6. And following on from that, you've got your advanced clinical practitioners, which takes you onto sort of band 8As and things, which is an apprenticeship level 7. So. Just trying to move on. Okay, so I did sort of do a little bit of a Google of the areas that we've got. So Will was talking about the different areas and how you find out about jobs. NHS jobs is sort of on the bottom of the list here, but I have also found a few of the website links for the different sort of areas within the ICS where they've got apprenticeship sort of posts or support worker sort of posts. Because there are 2 ways really of coming into sort of working within becoming a qualified person. One is you actually get the job as an OT or sort of as an AHP professional, a support worker, and you work up sort of within that with apprenticeship and other options, or you go directly on and qualify. But some places, and I think more and more, will be developing apprenticeship posts that you can apply for and things. And I know that a lot of areas are currently trying to get onto apprenticeships for AHPs within their areas. I know that radiology are really good at the moment. ODPs have a good sort of programme in place, and paramedics as well. Which is me to the last thing, where we've got South Central Ambulance Service. They've actually got a live chat on the 3rd where you can go on and find out about their apprenticeship sort of opportunities and things like that. And then I've also got the South East Coast Ambulance Service and things, links for those. Okay, so that's a quick summary of apprenticeships. So yeah, if anyone's got questions for Will, me, let me know.
Thank you for that, Caroline, and thank you, Will. I mean, that was really useful, and I think it's the second time I've sort of heard, Will, you've gone through this, and each time you sort of pick up some new information, and I was sort of jotting down a few notes and whilst you were talking, and it's interesting to sort of know just the amount of the workforce that AHPs sort of make up. So I think you mentioned a third of the workforce is allied health professionals. So just the impact and the importance of the roles and how they sort of form I guess that wraparound service to what people perceive as being core roles within the NHS, the typical doctors, nurses, but actually these roles, you wouldn't get the full recovery, the full sort of back to normal life without these roles in place. And it's really worth bearing that in mind in terms of how important they are. But just building from there, and I was just trying to put my mind frame into some of our existing staff that we've got at the moment, and how they would access the opportunities and the apprenticeships that you've spoken about. Now clearly there's a lot of information that's there around different sites to visit and different pathways that they can go down, but if we just quickly ran through a simple example. I'm currently working at Salt Hill, for example. I'm a band 2 or a band 3. I'm either working at front of house or I'm working, as a band 3 administrator stroke HCA. How would what's the best way for me to access one of the options? Would I need to start right from scratch? Would the work which I've taken or completed over the last 18 months be taken into account? Any of the prerequisites outside of industry, how much of that would be taken into account? I think it's really making this real for the people who might be on the call listening to this.
Yeah, I think with that kind of example, Gaurav, would be that there are different options, and and I think people need to look at the information and then see what works best for their kind of lifestyle and suits them. But if, for example, family commitments or other commitments, work-life kind of things wouldn't allow you to go to university and do a 3-year degree and go down that route, then you could look at and you still wanted to go down that route of being kind of getting that registration to be a occupational therapist, paramedic with that registration title, then you could go down the apprenticeship route. And I would recommend at the moment, just because there's not like lots of apprenticeship posts being advertised, is applying for a band 2 or maybe a band 3 HP support worker position in an area that you're interested in, and then show that eagerness within that provider and probably speak to them at interview about that as your kind of aspiration, and setting something up through that path, really. I know we've talked a little bit about kind of the apprenticeship route, and we're really keen to show how that career development can be done, and giving people the support for that. But we've recently just done some work on the support workforce through the Frimley ICS faculty, looking at this and doing a survey to the current staff, and it's kind of 50-50, where some people want to do an apprenticeship route or progress, and others they want to stay within their banding, within their level, still get other learning opportunities and develop, and we want to support both of those. But I feel like I've just been talking a lot about the apprenticeships and doing that. That's great, but it might not be great for everyone. So there's lots of different options, I think, depending on what people are looking for.
And as a recruiting manager, in my previous role as an OT manager, when we're looking at job applications, we recognise that people might not have that particular relevant experience within it, but what we're looking at is, do people fit with the job spec, even if it's their own personal experience of looking after a relative or something, and how that relates to the job role. So as long as you're showing an interest and a knowledge of the of those roles, then particularly at band 2 levels, you can have completely irrelevant work experience and still would get shortlisted, as long as you're demonstrating that enthusiasm and that knowledge of what's happening at shortlisting. If that answers.
Thank you so much. Yeah, I guess it's about making this as useful for the audience that we have, and the routes that would most likely present for themselves. And I think there'll be an abundance of enthusiasm, and it's just about directing that enthusiasm in the most effective ways for them. I can see there's a few comments in the chat around age ranges and limits, and I can see, Caroline, you've put in there around 18, but there are other options for younger people. So in the presentation, if I'm not wrong, you had an option for 14 to 18, and then there was 18 plus. Is that correct? Yeah. Okay. Now there was just one other thing
Guru,
that I was.
Guru, can I ask a question, please, if you don't mind?
Yeah, absolutely. Sorry. Go for it, Mohammed.
Yeah. Who just spoke now? Before you, the lady.
It was Caroline speaking.
That's me,
Yeah,
Caroline.
Sorry, Karen. Yeah, just pointing out that what you just said now, as long as you show an interest, I was showing an interest to a job which was in free admin. I'm currently admin right now at the vaccination center. It was up in radiology. She asked me a couple of questions, and obviously I asked her a couple of questions about the detail of the job description. She never had answers to. She said she'd get back to me. The first question she asked me, have you ever worked in hospital before? And I said no. And then from there, it was just dead tone after that. Even though I showed some interest, it was a dead tone after that, which I was a bit surprised. And she never got back to me at all.
Okay.
I did show interest. I did ask a few questions.
Okay. Yeah. So I think that what it is that we shortlist. So it depends on how many applicants there are in relation to it. So if they've got a lot of applicants that are coming with much more relevant experience, sorry, I should have clarified, then yes, you're not guaranteed, but it does, spark a manager's interest when we're seeing the application and we're seeing, yes, this person really understands what the role is and things. But yeah. Okay.
Will.
I've got a question for Will. Will, basically, I've seen this menu for opportunities for our bands 2 and 3. Yeah, I'm just getting confused with the whole scenario because there's so much opportunities. There's a list of everything. You got diagnostics, you got words, you got social care roles, you got allied health professionals. I really don't know which path to choose because there's just so many opportunities available. I don't know how to narrow it down. Could you give some kind of advice or kind of what action I can take in order to reduce the stress level that I have at the moment? I don't know how to reduce it. The directions of which I should follow. I don't know what to do now because there's so many opportunities available. I'm just wondering if you can comment or help me on this matter.
Yeah, I think that's completely normal. And I've been doing quite a few careers events at kind of different schools and other events. And I guess with the nice thing about AHPs is there's loads of different variation, but that might not be too helpful when you're trying to pick kind of a path. I would look at kind of what you're interested in, maybe what you found interesting when you've had studied things before, and that might give you a few clues. Like if you're more interested in kind of the way the body works, like biology and that science element, it might be looking at kind of more the physio, rehab assistant, those kind of things. If you're more interested in how the mind works and psychology and things, and then maybe OT might be something that you might be want to learn a bit more about. Or diet, could be dietitians. It's really, and always more arty and into stuff like that than an art therapist. But I would really encourage you to look at kind of aspiring allies, looking at what the different roles are, get a bit more information because there's 15. They're so vast, and then also there's some videos on there about what they may be doing day to day, and that work experience that I've sent it's quite intense. There's quite a lot to it, but I think that would be really helpful, and also could be used then to your future, looking at applying to jobs. If you've say I've completed the Spring Pod AHP work experience, that's something that an employer should consider as well. And I think with that experience you've had with that recent job that you've applied for, it would have been helpful for them to give you some feedback and saying maybe you don't have that hospital experience, but there are ways to get, similar experience. Things have been particularly tough at the moment getting that experience because of COVID and kind of the capacity and the demand for it. But I know different trusts are providing kind of volunteer ways to volunteer, and also reaching out to other providers a way you might be able to just kind of volunteer, spend some time to get some kind of experience, and that might help your, I guess, thoughts of where to go as well.
Valid point. Okay, no problem. I take that into consideration. Yeah, thanks.
Thank you, Will. Thank you, Mohammed. Great question. And I think that's something that plagues a lot of people's minds in terms of just the number of options and how to navigate those options. Now, there was one more question that we've got from Beverly around apprenticeships being full-time, or can you do them part-time?
Yeah, okay, so basically, in theory, you can do it part-time. In theory, it can take longer length of time. They are now kind of gone by a 30-hour sort of week and things like that. So sort of you are allocated sort of 6 hours a week of time for your study and things. I think that's a very new change that's just happened. And obviously with the lower sort of level sort of apprenticeships, sort of the level 2s and 3s and stuff like that, then yes, you are able to do it sort of part-time. I think it's harder, you know, and it can take longer for it, and you do need to get your employer on board with it, but it's always worth talking and negotiating. I mean, the whole of the NHS is all about flexible working and things like that, so you know, it is something that if it's in people's power, then they should try and do it. But some areas it is very difficult, so it might be that they want it as full time. Okay.
Super. Thank you, Caroline. Beverly, hopefully that answers your question there. Okay, I just want to say a huge thank you to both of you for coming today and presenting and talking through the various options. And I know that there's a lot of information there. One of the things that we always try and endeavour to do is follow up, provide information that you've given us to everybody that's on the call and beyond. Also, we're recording this session, so it will hopefully reach the whole audience. And beyond that, any further contact details or you know, I know we've got your email address there, Will and Caroline. You know, if there's any details that you'd like to share for people to have that one-to-one conversation directly with you, or that email conversation directly with you, and not in a sort of wider public forum like this, then if you're happy to share that information, please do, and we can then share that with the group.
Yeah, the details will be on the presentation that we'll make sure you get through from both of us. Yeah.
Fabulous. Well, thank you so much for this morning, and I know a lot of work's gone into preparing that, but hopefully it will yield some results and some benefits, and we'll get some interest from the group. And I guess building from the whole sort of apprenticeship side and you know, the AHP side, I'm pleased to announce that we've also got Cusham and we've got Gemma who have joined us. And Gemma, thank you so much for joining us on your day off, I believe. So welcome. I'll let you guys do the introductions on yourselves before you sort of speak about, you know, the areas that you're going to cover. Hopefully more so the primary care side, but again, it's a bit of an open agenda and an open platform, and we try and keep these sessions as useful and as informative for the audience that we have. So, you know, the floor is yours. I'll let you guys introduce yourselves.
So my name is Gemma, for those of you who I don't know. So I have fairly recently joined the Frimley Training Hub team. So I've been in post now, I think this week, end of week 8. And I'm one of the project managers over at the Frimley Training Hub, and we'll go into a little bit more in a minute about what we are as a team and what we do. I'll let Kush introduce herself first.
Hi everyone, so I'm an apprenticeship lead and I look after GP practices across the Thames Valley area, supporting them with anything and everything to do with apprenticeships. So after Gemma's talked about the roles in primary care, I'll talk a bit about our apprenticeship opportunities.
Okay, lovely. Right, we've done a few slides, so I'm just going to whiz through a few of these and then we can get into some conversation and for people to ask any questions that we might have. So can you see the slides?
Oh, yeah, they might take a
okay, bear with me. It would help if I was sharing my screen properly. Okay.
Perfect.
Here we go. Let me just do it into presentation mode. So it's a bit easier to see. Okay, is that all good?
Yeah.
Yes, it's all good. It's all good.
Fab. Right. So in terms of who we are as a team, so Frimley Training Hub. So we are Essentially, in a nutshell, how I describe us as a team is a learning and development team for the world of primary care, essentially. So our role as a team is to support the workforce, so the development of the workforce coming through, support those who are already enrolled in primary care with their sort of continuing professional development, and support with the retention of the workforce. So how we manage to keep people in those posts and don't have a high turnover in those roles that are out in primary care. So we basically, as a team, we work across the whole Frimley ICB footprint. We receive funding from Health Education England and NHS England. As a team, we're hosted at the ICB, so what was the CCG previously, and we provide workforce development, education and support the primary care networks, which are groups of GP practices across the footprint, support them with their workforce planning and those individuals who work out in those practices. So in terms of the Frimley ICB footprint, so where we're working, there are 5 places. We have 16 primary care networks, which, as I said, are essentially groups of GP practices working together. And we have 74 GP practices. So this is just to really give you a feel for, when we talk about primary care, what we are talking about is essentially sort of general practice, GP practices. One of the opportunities that we're here to talk about today and to sort of flag, it is in development at the moment, but it's called Locum Deck, and we've currently got this for locum GPs, and it's in development for our locum nurses who are working across the footprint. It's similar to the acute trusts where you will have a bank of staff who will do shifts across different departments, and this is essentially what this is, but for the world of primary care. I don't know the ins and outs of how much you know about primary care, but essentially GP practices are their own sort of individual businesses providing services on behalf of the NHS, and we have 74 of those individual practices across our patch. So the idea is that by having a central pool of staff that could be accessed by the different practices, so when they know that they've got a healthcare assistant, for example, that's going to be going off on leave, if they've got a member of staff who is off on long-term sick and they just need some additional capacity within that team, the idea is that there is a bank of staff available to sort of fill some of those gaps. So very similar, like I say, to how sort of bank or pools of staff currently work with some of the bigger trusts and community trusts. And so at the moment we're looking at, this is in development at the moment for healthcare assistants. We've got it for our locum GPs. We are in the process of onboarding our locum practice nurses. They would be band 3 roles. They would need to have a care certificate and be competent in a core set of clinical skills. NASGP, which is a local organisation historically who have supported locum GPs, are delivering the projects on behalf for us and working alongside us. And in order to get around the hosting, as I said, because we're essentially working with 74 individual employers of those 74 practices, what will happen with the bank is that they will hold a contract with a single employer. So for the practice nurses, we've got Surrey Heath that have been employing those. They will employ those practice nurses, and they will do the sort of back office stuff like the pay, etc. As I've said, we've currently got this in place for our GPs, our locum GPs working across the patch. We are starting to onboard our nurses, which means that we would have to do, in order to ensure that we are doing quality checks and ensuring that those members of staff can meet those competencies of those delivering some of those clinical skills. That's all sort of managed in-house. So we're in the process of doing that for our nurses, and we are concurrently about to start doing that for our healthcare assistants as well. So this is potentially an opportunity for any of those sorts of band 3 roles who have got some of those sort of clinical skills. We do offer a training support package for our healthcare support workers, and we are looking at how we could support staff that are going to be joining this sort of bank, this locum deck pool of staff, to ensure that they are meeting some of those competencies around some of those sort of core clinical skills that we would expect a healthcare assistant working out in general practice to have. I'm going to keep going through, but do just feel free to interrupt me if you've got any questions, because I've only got a single screen at the moment. I can't see if anybody's got their hands up, so I'm just going to keep talking, but do feel free to interrupt, and there'll be time for questions at the end as well. The other thing I wanted to sort of flag as a potential opportunity for people who have sort of dipped their toe into the world of sort of healthcare maybe for the first time, is that the scope of general practice has changed. Historically, as you may know, from years gone by, when you may have gone along to your sort of family doctor, to your GP, the traditional model was very much you had your sort of reception admin team, you might have had a healthcare assistant at the practice, you've got your GPs, your doctors, and then you've got your practice nurses. The landscape of what that team has really changed over recent years, and there are increasingly more roles that are coming historically out of kind of the acute sector and into primary care. There's been a big push over the last few years to embed a number of roles out within GP practices, and GP practices are incentivized to recruit to some of these roles. And some of the new roles coming through are what we call, they're often just referred to as kind of packed roles, but these are sort of supporting the anticipatory care agenda and the personalised care agenda. And some of these roles are social prescribing link workers, care coordinators, and health and wellbeing coaches. There is some overlap with some of the roles, but they are very distinct roles in their own right. There's a little diagram there that might give a little bit more information about what some of those roles do, but they are there to work as part of that multidisciplinary team out in primary care, taking referrals from maybe if a patient, for example, presents to the GP, but actually it's not a clinical need that they've maybe got, but it might be that they're isolated, they're lonely, they're not motivated to sort of make some lifestyle changes, any sort of wider sort of social sort of things that are impacting on their health and well-being. The idea is that that member of that team would refer into one of these roles, and that person, whether it be the link worker, the health coach, or the care coordinator, depending on who is most appropriate, would really support that person to develop a personalised care plan and to support them to really sort of take the time to dig down and to unpick what some of those issues might be, and to work alongside that person to sort of reach a set of core goals. These are often employed out within these primary care networks. So as I said, the sort of scope of primary care changing slightly, increasingly, rather than GP practices working individually and on their own, they are coming together to work as group of practices, often referred to, you might hear them called PCNs or primary care networks. And these roles are often recruited by those primary care networks, and you would be working across a practice or a couple of practices, depending on their size, taking those referrals and then linking that person in to the most appropriate sort of ongoing services. So it could be that it's linking them into a local chess club if they're isolated. It might be supporting them with signposting them on to some physical activity of some kind, and working with them and using some sort of tools and techniques to really support them. So motivational interviewing, some of those sort of personalized care planning. So really equipping people in these roles with some of those skills and techniques to support them. They are sort of, depending on the role, they are band 4 and 5 non-clinical roles, but really working as a core part of that practice team. There is a bespoke induction and training package that we offer. There isn't a set, criteria to come in with it. It's very much about assessing what those individuals, the things that are really needed are those really strong sort of communication skills and interest in health and wellbeing and improvement. There is some, I've put a link on there to the NHS Careers website, which has got a little bit more about those roles and what the eligibility and access criteria are. And if you're interested in any of these roles, they are being recruited to by PCNs as part of this ARS programme. It's referred to, the Additional Roles Reimbursement Scheme is what that stands for. And they are being recruited to directly through PCNs. We are supporting PCNs with their ARS recruitment. So if anybody is interested in this, in any of these roles in particular, please do get in touch and we can look at whether we can support you with linking you into some of those practices that are recruiting into the roles. Any questions on that? Again, I can't see, so do just shout if there is anything. And I'm just going to hand. Oh yeah, sorry.
What's I can see on the screen the band 4 and 5 non-clinical roles. Can you kind of expand what that is, please, if you don't mind?
So yes. So with them, depending on which of the 3 roles, so specifically thinking about that, there are other roles involved in the ARS schemes, but these tend to be sort of more clinical roles, so paramedics, etc. But with the non-clinical roles, these are the non-clinical roles within that ARS team. So the social prescribing link worker, the health wellbeing coach and the care coordinator. And the link worker role is a band 5, so an NHS band 5 role. The care coordinator and the wellbeing coach is a band 4s, I believe. Okay. But again, I'm still relatively new into the team, so please, I will definitely come back to you if I'm incorrect with any of the information.
Not worry, not worry. I'm at the meantime, I'm taking some of these screenshots as well at the same time we're speaking. So if I've got any questions or you know, I can always drop an email. I've got your name as well. I've got an NHS email as well, so I can search your name as well and send you. I drop you an email as well. You know.
Yeah, and we've got these slides, and apologies for not getting them across to the team in time, but we'll definitely share the slides with the team and they'll be shared with you all. And that's our team email. So if you any questions on any of them, do just come back to us.
That's great, no problem.
I'm just going to hand over to Kush to talk through some of the apprenticeship stuff. Kush, do you want me just to keep sharing and you just tell me when you want the next slide?
Yes, please. That'd be fantastic. So apprenticeship opportunities in primary care, it's a bit like Carol and Will described earlier. If you get your foot in through the door, do the roles, you know, healthcare associate, healthcare assistant, reception roles, business administration roles, you can then start to develop your skills within our sector using apprenticeship programs. There are different ways that you can develop, so it's not all about apprenticeships, but there are lots of opportunities now for our sector to engage with these programs. So I've just given you some examples for the clinical and non-clinical type of apprenticeship programs that we have. But if you skip to the next slide, I'll just show you a couple of pathways that people can explore. Is it moving on? Lovely. So this is a clinical example. So you can come in as a healthcare assistant. There's an apprenticeship there that Caroline described earlier, the healthcare support worker, and there's a level 2 and a level 3. There's apprenticeships available there. You can then step into a trainee nursing associate, which is a foundation degree programme. It's a fantastic role in that it supports practice teams with their nursing caseload. So you can do things like with lots of skills development, certain immunisations, or lower complex tasks like wound care, for example. But there's so much on there, and if you want some more links to that information, I will send those across. But you can develop potentially as a trainee nursing associate, which then leads on to accelerated routes to becoming a registered nurse. So as you can see, once you're in, the opportunities are actually endless, and it's just about finding a GP practice that is seeking to support and keep their valuable staff. So if you're applying with a practice for, you know, whatever role it is, ask them about how they feel about progression and using apprenticeship training. If you skip to the next slide, this is a non-clinical example where you can come in reception or admin type roles, and you can do different pathways. So medical administration, normal administration, and then stepping up through the management, so team leading and operations management. But actually, where Gemma described primary care networks, some of these are larger organisations. So just one example is the Surrey Heath PCN providers. They have back office support functions like human resources, finance and accounting, you know, marketing, some of them as well. So there are apprenticeships in those areas, and project management and quality. So quality is a really, really important area. If you skip to the next slide, just mindful of the time. So we are, having said you get your foot in through the door and then you do apprenticeships, we are actually about to promote some business administration apprenticeship opportunities. So they're going to come out next month across, I think there are 3, possibly 4 GP practices across the Frimley area. So if you want to register your interest, if you email that email address there and just sort of express an interest, address it to me. I'll put my name in the chat for you, and when those come out, I'll send you the job pack. Trainee nursing associates the roles are advertised on NHS Jobs, but also on Indeed. A lot of practices do use Indeed, so please have a look at that site as well. And of course, the National Apprenticeship website as well. So I'm mindful in the chat there was a question earlier about upper age limit. So somebody asked about, you know, for the allied health apprenticeships, is it a limit of 18? There is no upper age limit with apprenticeship. So as long as you're in a job with the right occupation, you can be any age. And I know somebody in the Thames Valley area who's 70 doing an apprenticeship. So there literally is no barrier for age. That's it from me. So are there any questions in our last minute that we've got together? Giving you a lot of information. That means.
I have a question, but I'll drop you an email anyway, yeah?
Oh, no problem.
I think you've stunned everyone into silence. I think that's been a really, really helpful whistle-stop tour. I think there's a lot of information there. I think as always, having the information for people or the contact details for people to actually follow up with is really important, because I think some of the real meat is added during those conversations. But I think just introducing them to the idea of the opportunities that are available is a massive win and a massive first step for us to take. And just knowing that hopefully we reach as many of our staff as possible, and for them to then get in touch with yourselves to progress in one of the many varied options that you provided would be a great outcome. Thank you so much for your time today, and you know, you guys have run the session, all of you. We've done very little today. We've just sort of sat back and watched the show, but you know, I guess this is the power of being in an integrated care system where we can all work together. Before I conclude, I've seen a hand up by Nata Fernandez. Nata, do you want to ask your question?
Yes, hello, good morning. I would like to know opportunities for nurses to, for example, to work in a surgery, in a practice, to become a practice nurse. Is that possible? I did some investigation, and all the jobs that I looked, it was required to have the public health specialization to do to be a practice nurse, and I would like to know if it's available any support or any apprenticeship or mentorship on this area, please.
Yeah, so there's a couple of options depending on what qualifications and experience you hold. So if you've got qualifications,
General nursing, to be honest.
General nursing, that's fine.
Yeah.
So providing, you know,
in hospital.
Okay, perfect. So we've got a GPN fundamentals, general practice nursing fundamentals program that we recommend. It's 6 months, and you can do it while you're working in a GP practice. And what that gives you is the skill set to understand the differences in primary care, because, you know, working in a GP practice, you work from birth to end of life, you see all walks of life, you see the whole range. So it is fantastic, but you are working at a different pace. So the GPN fundamentals program with Buxton University would be the way to go. But, you know, I believe you need to be working in the job in order to do that, Gemma. I don't know if that's your understanding.
Sorry. And can I just add, is I believe, I don't know, but I believe that working in a nursing home so near with the GP practices might be a plus and might help, right?
Yeah, absolutely. Working in any part of the system, but yeah, having that understanding of how social care and primary care interact, yeah, will definitely be a plus.
Okay.
But there will obviously be, the clinical tasks will be probably broader.
Okay.
So there will be skills that you will need to pick up, but that shouldn't be a barrier for you to applying for the roles, because practices are desperate for experienced nurses.
Are they?
And they are
That's
more and more open to not, you know, yes, it'd be great to have experience within another practice, but that's not the be all and end all. You know, we are taking people on and then giving them that experience. So yeah, please have a look for the jobs.
Okay.
Generally on Indeed, and have a look at NHS jobs as well.
Okay,
And
I will do.
Yeah. All right.
Thank you so
Brilliant.
much. Thank you so much.
All right.
Thank you. Bye.
I'm sorry, my internet cut out, so I had to drop off and come back on. So I missed the bit, Kush, where you said, "Can I add anything?" I picked up that bit and didn't get the bit before, but I'm sure
That's
you
all
answered it beautifully.
Yeah, I think you've done a great job there. Thank you. Well, as I was sort of concluding before, I think, this has only been made possible because of the way and the manner in which we all work together as a system. And I think there's real benefit and gain to be made from the workforce that we've built over the last 20 months. So it'll be a real shame if we just at the end of August, when the Mass Vac site closes, say, well, thanks for all of your help, but now there's not really much for you to do. It really is about, look, guys, there's a lot to do. There are lots of areas to explore. Mohammed touched on it earlier in terms of there's so many options, not sure how to navigate them. So that's only a positive that we are providing those. And now with your steer and your guidance, they can hopefully turn some of those options into, some kind of fruition of a role. So thank you again. Thank you, Will. Thank you, Caroline. Thank you, Gemma and Kusham, for today's session. And thank you for my team for helping pull this together and get you guys here on time as required. So Aishan, Patricia, thank you to you guys as well. And we will see you all next week for the next round. So take care now.
Thank
And
you.
enjoy Neighbours. Enjoy the
you all.
Commonwealth game and enjoy Neighbours.
Thank you so much.
All right, take care now. Bye-bye.
Thank you.
Thank you, everyone. Bye.